Hello friends, once again Dr. Ravindra Nikalji. I am a consultant nephrologist and a transplant physician at Apollo Hospital, Navi, Mumbai and Apex Kidney Care, Vashi. Today I am going to talk to you on a very important and a common topic which is known as a urinary tract infection. Now most of you or all of us have suffered from some form of a urinary infection in our lifetime. Now you know it is not a very serious problem, but it's a very common problem and you should know how to prevent urinary tract infections. So now urinary tract infections are more common in females, especially in the younger age and in the reproductive age. Whenever a urinary tract infection occurs in males less than 1 year of age or between 1 to 50 years of age, then there are some underlying serious urological abnormalities associated with it. So urinary tract infections are usually classified as either a lower urinary tract or the upper urinary tract. The lower urinary tract infections are common, they occur again and again, and they are more common in females, and the normal symptoms being frequency of urine, burning in the urine, lower abdominal pain, some fever or lower backache. So if you are suffering from these symptoms, it is very important that you should do a basic urine test called urine routine or urine microscopy to see what kind of infection you are suffering from. Many times the doctors will advise you to do a urine culture test, especially if you are suffering from recurrent urinary tract infections, and doctors will prescribe you an appropriate dose of antibiotic based on the urine culture and sensitivity report. Now when the infections happen in the upper urinary tract, that is kidneys or ureter, these infections are a little more serious than the normal lower urinary tract infections. Most of these infections need intravenous antibiotics and you may need to get hospitalized. So it is very important that you do not neglect the lower urinary tract symptoms and try and treat them at the earliest so that you do not develop upper urinary tract infections. It is a myth that urinary tract infections do not cause any damage to the kidneys. Many times we see that recurrent urinary tract infections or infections affecting the upper urinary tract can lead to loss of kidney function over a period of time. There is a condition called chronic pyelonephritis, which is number 3rd or number 4th cause to develop chronic kidney disease in our country, and most of the time even patients are unaware that they have a urine infection, and the tendency is to neglect these symptoms and neglect the treatment for various reasons. So my sincere request to all of you is please do not ignore symptoms pertaining to the urinary tract, which are frequency of urine, burning of urine, if you have to get up frequently in the night to pass urines, or you have any difficulty in passing urine with free flow. So these symptoms need to be investigated. You need a basic urine test, you need a sonography and visit to the physician to understand what are causing these symptoms. This is important to protect your kidney function in the long run, and this is important for better quality of life. You should have a good intake of liquids, especially around 2.5 to 3 liters if you are suffering from recurrent urinary tract infections. And this is much more important in the summer season when you need to step up water intake further. You need to reduce your salt intake and sugar intake, and you need to control your diabetes or sugars well in the normal range if you are a diabetes also. So with these simple tips, my friends, you can prevent urinary infections and you can treat urinary infections in a better way. If you want any more information about urinary tract infection symptoms, diagnosis and treatment, please feel free to visit my website or you can contact the below mentioned numbers. Thank you so much.